Well, today is a really exciting day for me because my Shockwave machine has finally arrived. This is a Stores Medical MP50 Shockwave machine, and Shockwave in terms of as a therapy has been around pretty much as long as me. So it was first used in 1980 as a treatment technique to treat kidney stones, and they basically use the shockwaves to blast apart the kidney stones instead of going to invasive options. And what's happened since is that they've modified it and tailored it more to musculoskeletal conditions, which is fantastic, which is where physios typically use these days. The application of it, fairly straightforward. So there is a probe with various different ends on, which target tissues at different depths, and it fires sound bullets is the best way of thinking about it. It's a sound wave that it sends through, has various different effects which I'll talk about in a minute. It is a little bit noisy. I'll do it so you can hear. Not too bad. It's not painful. There is a sensation when you apply it. We have to apply it using ultrasound gel as well, because with it being a sound waves don't travel too well through the air. They travel better through a water-based medium. So ultrasound gel, probe on, bit noisy, a little bit uncomfortable. But the main selling point of this is that it is completely safe and really, really effective for lots of different types of conditions. So I suppose the next thing you'll want to know is what's it used for. Well, there are lots and lots of nice guidelines for the application of shockwave therapy in musculoskeletal conditions, but the main ones are actually highlighted on this screen here. It's primarily used for horrible, nasty, chronic tendon problems. So we're thinking things like achilles tendinopathy, plantar fascia problems, patella tendinitis, jumper's knee, lateral hip pain, so greater trochanteric pain syndrome, real typical one for runners, start to develop lateral hip pain, panic, it's the hip joint, it's not the hip joint, it's usually the gluteal tendon. So that, tennis elbow, golfer's elbow, calcification of calcific tendinopathy of the shoulder, all those kind of things, shin splints, anything which is really to do with tendons or tendon type tissue is where it's used best. Next thing I suppose is does it work? Well, it's got an 82% success rate, which actually in medical terms is pretty good going. It tends to increase healing times by up to sort of 40%, so that's fantastic. And studies that have been done on achilles tendinopathy have shown that 90% of patients that have shockwave will go on to make a complete recovery or have a significant improvement in their pain. So why are tendons so difficult to treat? Well, the main reason is that tendon is basically just a tissue which attaches muscle to bone, so it has very low energy requirements. It doesn't really do anything other than hold two bits together. So because of that, it's got a really poor blood supply and really low oxygen supply and all those kind of things, which means that healing's slow. So you've been training for London Marathon, you've suddenly started to increase what you do, you have overloaded the tissue at a rate beyond what the tissue is able to give you because you've just stepped up your training too quickly, and it causes little tears in the tendon. And what tendons pull at then is actually healing, and everything kind of just grinds to a halt, the problem rumbles on, you stop running for a bit, feels better, you go back running again, it starts again, and on and on and on we go. So what this does, which sounds a little bit crazy I suppose, is that it's a pro-inflammatory machine. It creates inflammation, which we need in order for healing to occur. It's the first stages of healing. So the problem with tendons is that they lack the inflammatory process. They don't have that inflammation, which then would kickstart the natural healing response. So this does that. This creates some inflammation so that your body can then go through its natural healing process in order to recover. One important thing to say with this is that it isn't a magic bullet, in that it's not just this and then everything's fixed. this is very much used in conjunction with all the other conventional things that we do. So we would still be doing hands-on physio, we would still be doing, or you would still be doing all your eccentric loading and all your rehab and all your strength and conditioning work. That doesn't change. The big difference with this is that usually after about 3 sessions, your pain level drops substantially. And what that means is that you can get back running, you can get back to the gym, you can get back doing the things that you love to do that the normal tendon problems would stop you from doing. So it gives us that in, it brings the pain down, it gets that inflammatory response going in order for us to then make those structural changes through the loading programs and such as that. So, given that this is basically a gun which fires high energy sound bullets at the tissue, you would expect to feel something, and you need to feel something while the treatment's taking place. It's not painful, it's not supposed to be painful, but what is required is that we do need you to feel a sensation of about 4 or 5 out of 10 whilst this treatment's taking place. Any less than that and we're not doing anything, any more than a 5 out of 10 and you're gritting your teeth thinking, oh, I'll just put up with it because it must be doing me good, no pain, no gain. That's not true either. It needs to be comfortable and manageable. So all the way through treatment, there's a constant dialogue between the physio and the patient. How's it feeling? Where are you out of 10? Oh, I'm a 3. Right, okay, we'll turn it up a little bit. It's a bit of a 6. Right, we'll drop it back down again. So there's nothing to worry about with it. It is not painful, but there is a sensation, and that's normal. So the next thing you want to know is, will it work for me? And it's important to say that no medical treatment's 100% effective. It's just not. This is 84%, which I think is pretty good. What we will do, what I will do as your physio, is basically clinically reason as to whether I think it's worth giving this a go. The people who this is most successful for is for people who have got tendinopathies, tendon problems, plantar fascia problems, all those kind of things that have been there for a little while. So normally things switch over to being chronic at about 3 months. So you've been struggling with it, you've tried all the conventional stuff and it's not getting better, you're kind of the perfect patient for this. So when you've tried everything else and exhausted it and it's not, nothing else has worked, then Shockwave is probably a really good option for you. In terms of how many sessions you'll need, it's usually between 3 to 6 sessions. Certainly 3, because what we see, I think I mentioned it earlier, what we see at session 3 is a massive drop in the pain level that you've got, and those first 3 need to be carried out at weekly intervals, and then onwards from there. So yeah, minimum of 3 up to 6, sometimes more are needed. Everybody's different, so that's your general sort of numbers, but yeah, everybody's got their own circumstances, everybody's got different degrees of injury, so it will vary. So the most important thing that you'll want to know is how much is it going to cost you. A Shockwave session or a treatment session, including Shockwave, is £70. It will last half an hour, as all my treatment sessions do. It's not just this that you're getting within that 30 minutes. So all the normal stuff, all the rehab, all the hands-on stuff, all the regression of exercises continues. So it's basically treatment session with Shockwave, and it is, it's £70, slightly more expensive. What we're doing, because we know that you need at least 3 sessions, then you can book those as a block, and the cost for that is £200, saving you tenner of the cost if you're booking them individually. And then after that, after those 3, if you feel like you need some more sessions, then you can just pay as you go and just pay 70 quid, or you can book a block again if you would rather do that. So, in summary, if you have got any tendon problem, plantar fascia, achilles tendinopathy, patella tendinopathy, calcific tendinopathy of the shoulder, lateral hip pain, golfer's elbow, tennis elbow, anything like that, plus lots of other things which I haven't listed that this is used for, then it's worth giving it a go, especially if you have had it for a little while and nothing's working, especially if it is absolutely driving you mad because you can't go and, you know, do your squatting or do your training or whatever it might be that you're wanting to get back to, or if it's just causing problems at home and you can't play with the kids the same, you can't throw the ball for the dog, whatever it might be, it could well help you. So yeah, best thing to do is to just drop us a message or give us a ring. I'll put the number at the bottom of this video, and just say that that's what you're interested in, shockwave therapy, and then we can get something booked in for you. Thanks.